respiratory pathology, lung cancers. So once again, lung cancers are the leading cause of cancer death. We already discussed it in the epidemiology section, but be aware that they could ask you a question on it within the stats section, okay? But they like to ask about the increased mortality that's associated with lung cancer. So moving forward, how can we check for lung cancer? Well, the first thing that we have to do is that if I find a nodule within the lungs on chest x-ray, I'm going to check previous chest x-rays, and that's a question that they like to ask. And the reason we check previous chest x-rays is to see if that nodule is new or if it's been present throughout life, okay? If it's old, then we think it's probably going to be benign, but if it's new, then we're going to be thinking more deadly, something that's cancer-related, okay? Now, those lesions are known as cone lesions on chest x-ray, and they're non-calcified nodules, okay? They like to metastasize, okay? In the lung, metastases usually are multiple lesions, and they're more common than primary neoplasms. That's pretty much for everything else. So mets to the lungs is more common than primary lung cancers. Another thing that you have to know is that lungs like to metastasize to other areas, okay? Specifically the liver, the adrenals, the bone, and the brain, okay? Now, lung cancer is separated into two types. There's the small cell types and there's non-small cell type. And small cell has its own type because of the vast pathophysiology behind it and the characteristics that are associated with small cell, right? Now, to begin off, I'm just going to give you a couple hints on how you can differentiate. First off, small cell or squamous cell, so anything that starts with an S, is associated with smoking and it's centrally located. So smoking, centrally located, it's the S cancers, okay? Now, to begin off, we have the small cell or oat cell carcinoma. This is highly associated with male smokers, and this is the most aggressive form of cancer of the lung cancers. Okay. Once again, it's centrally located, and what does that mean? That means that it's near the hilar lymph nodes. Okay, so that they can say like near the hilar lymph nodes, something like that. But it's not on the periphery. It's not near the pleura. Right. It's located centrally near the mediastinum. Okay. And small cell carcinoma is very aggressive. And what they love to ask about is the associated pathologies with it, okay? So the one associated pathology with it is Lambert-Eaton myasthenic syndrome, okay? And so Lambert-Eaton, all that it is that we have autoantibodies to our calcium channels at our neuromuscular junctions. And so when we have that, we have antibodies to those calcium channels, it leads to an inability to essentially move as well as we normally would be able to, okay? And they like to differentiate it with myasthenia gravis. Myasthenia gravis versus Lambert-Eaton are two things that we have to understand. Myasthenia gravis has autoantibodies against our acetylcholine receptors, okay? So with myasthenia gravis, which is not associated with small cell carcinoma, we can't get over it. Even if we try to work harder and harder, it's hard to get over it. We can't, okay? So throughout the day, we get more tired, okay? With Lambert-Eaton, the blockage to the calcium channels, as we work at it, we actually get better and better with our muscular movements, okay? So at the beginning of the day, it's actually somewhat difficult to move, but it gets better throughout the day. And that's a very key differentiation between myasthenia gravis and Lambert-Eaton. So Lambert-Eaton is the association with the small cell carcinoma. They love to ask about that. A number two association with it is Cushing syndrome, okay? And Cushing syndrome is just due to the fact that it has an increase in ACTH, okay? So you'll see increased levels of ACTH. Lastly, and most importantly, you also have the number one cause of SIADH, which is syndrome of inappropriate ADH. And so we're going to see increased levels of ADH secondary to small cell carcinoma. And they love to ask about it. It's the highest yield association because it's the number one cause of SIADH. And we'll talk about SIADH more in depth when we get to the endocrine system. But overall, these are the things you need to know for small cell carcinoma. It's Lambert-Eaton association, it's increase in ADH, as well as an increase in ACTH. Okay? Those are very important. And the way that I remember it is SMAD. SMAD. So that helps me remember that small cell, SM, is associated with ADH increase. And you'll see later on why I have a mnemonic for that, or just kind of a trick to memorizing it. Lastly, for small cell, it's a neoplasm of neuroendocrine cells, so you're going to see a chromogranin A positive cells. And they're going to look like small dark blue cells on histology. So make sure you look up what histology it looks like for small cell carcinoma. That's all that you need to know. Once again, small cell carcinoma, it's most aggressive cancer associated with male smokers, seen in central location of the lungs. It's associated with Lambert-Eaton syndrome, associated with SIADH, number one cause of SIADH. So we have increased ADH levels. We also have increased ACTH levels, which can lead to Cushing's. And we have a neoplasm of the neuroendocrine cells, which means that those dark blue cells are going to stain positive for chromogranin A. Next is adenocarcinoma. Adenocarcinoma is associated with non-smokers and females. It's the number one cause of cancer in non-smokers in women. So keep that in the back of your mind. If you see a patient that comes in with lung cancer that was not a smoker and they're a female, start thinking about adenocarcinoma. Now, it doesn't start with an S, so it's not associated with smoking, once again, non-smokers. And that also means that it's in the periphery. So there's peripheral involvement, or pleural involvement is another way that they could say it. Okay? What they love for you to know about this is that there's glandular pattern that often stain mucin positive. Okay? So if you see like mucus or mucin positive, then you know you're dealing with adenocarcinoma. Okay? Very important. Next is squamous cell carcinoma. Squamous cell carcinoma starts with an S, and so once again, it's associated with those male smokers, and it's located centrally. Now, you're going to be affecting there's going to be like a hilar mass, and it's highly associated with PTHRP production, which is PTH, or parathyroid hormone, related peptide production. So you're going to see increased levels of PTH, which can lead to, or PTHRP, I should say, which leads to hypercalcemia. Okay? And so the way that I remember this is SQAP, SQUAP. SQUA is for squamous, and then the P is for PTH. So that's how I remember the difference between SMAD, small cell, for ADH, and SQAP, squamous cell, for PTHRP. Okay? Lastly, for squamous cell carcinoma, and all squamous cell carcinomas, not only associated in lung cancer, but all throughout the whole entire body. If you see squamous cell cancer, then there's going to be keratin pearls and intracellular bridges. Okay? They love the keratin pearls. I did not know that all squamous cell carcinomas showed keratin pearls. So now you know, and now I know, that it doesn't matter where you're at, it doesn't matter what organ you're in. If you have a squamous cell carcinoma, then you have keratin pearls on histology. And they love to ask about those. So know what they look like and know what cancers later on. You're going to learn every single cancer that has it. It's going to be all squamous cell carcinomas have this keratin pearls. Okay? Last, but pretty much least, I mean, we rarely get questions on this, is large cell carcinoma. It's strongly associated with tobacco smoking, even though it's not started with an S. But I haven't really seen many questions on it. Also, something that is relatively not important, once again, is bronchial carcinoid tumor. We'll talk about the carcinoid tumors later on within, I believe, the GI section or the endocrine section. But symptoms lead to like wheezing, and you get flushing and diarrhea for any carcinoid tumors. And we'll talk about it more in depth later on. But I can't stress enough how important it is that small cell carcinoma, adenocarcinoma, and squamous cell carcinoma are within the overall lung cancer chapter. The last thing I'll note that I forgot to add is that lung cancer is highly associated with not only smoking, but also radon exposure. And so they love to say like patients that stay in the basement for long periods of time because radon is within the ground, they have an increased risk of lung cancer. But I'm pretty sure that's somewhat common knowledge for people, but I don't know. I didn't really know that, so I just wanted to pass along that information.